7% of Indians are pushed into poverty every single year.
By just having one family member have a serious health condition. Lifestyle diseases have become the number one cause of death and hospitalization. We are having this healthcare crisis with a younger population today. Imagine what is going to happen in 20 years as this population ages.
Vishal Gondal runs GOQii, a platform tracking health patterns of millions of Indians every single day.
For 9 years, he's published the IndiaFIT report, a real-world snapshot of how our fitness levels, habits, and healthcare costs are changing.
Today, we decode what the numbers tell us and why India may be heading toward a silent health crisis.
People who have insurance, almost 72% births are cesarean, versus less than 20% of cesareans in a non-insured category. The minute they see you having an insurance policy, the pricing of all the services are different. What most companies are today doing is only way to get profit is by denying the claim. So it's the perfect storm that the healthcare companies, the insurance companies, and the pharmaceutical companies all together are trying to make money from the consumer who has currently no say in this. We did a survey of 10,000 people asking them, who do you trust in healthcare? 98% people said they don't trust doctors, hospitals, insurance companies, pharma companies. And then we asked them, who do you trust? The number one name was
You created something called the IndiaFIT report. Can you tell us about that? What is the IndiaFIT report?
So it was, first of all, very incredible that India does not have any much data when it comes to the health and fitness sector. And whatever data was there was most very hospital centric, that how many beds we have and how many whatever operation theaters do we have and so on. So we wanted to first of all bring the report from a consumer's perspective. What is really happening?
Not from a medical fraternity perspective in a way,
but from a consumer perspective. And with GOQii, we started having millions of users across the country. We started speaking to millions of people. So we started getting data from each city. And that gave us the insight of what is actually happening on the ground. And that is how we put together the first IndiaFIT report. And now we have got almost 7 or 8 editions of the report. And in each time, in each year, we try and bring out a new facet. And we also then try and rank the cities based on the health. And one of the startling difference was, for example, a city like Calcutta. From our data, it is one of the most unhealthiest city from a health perspective. But what we also learned was even the medical facilities there are so poor that most people from Calcutta actually travel to Delhi, Bombay or Chennai for their health treatment. So we started figuring out the patterns of health, and not just health, on how people are getting access to health.
And which is the healthiest city? You said Calcutta was the least healthy city. Which is the healthiest city?
So healthiest city, we keep changing every year. But I think if I am not mistaken, the last year Mumbai was one of the among the top, because of the sheer number of, at least there is a, we are the maximum city, we can continue to walk. Bangalore actually came up comparatively better. So what we are seeing is a correlation between the city and public transport and how much you can walk.
Infrastructure, safety.
All of those things.
Right.
And Bombay is also lucky to have, while there is pollution, but the pollution is not as, only in certain months.
And not as extreme weather also. The summer is, so I guess those things make a difference also. And you spoke about the US a few times because you said we're going towards the US in terms of the, insurance and hospital systems. So what do you think will happen with India as its population ages, when you look at America?
Healthcare is the only system where by spending more money, you are getting more sick people. Normally, in any other system, if you spend more money on education, it will get you more educated people. If you spend money on more sanitation, you will possibly get better sanitation facilities. If you spend money on housing, you will build more houses. Healthcare is the only place where the budget is going high and sick people are also going double high. So it's actually a problem. And
why is that?
Incentives are misaligned because this budget is going to the system which is incentivized to have more sick people. And finally, there is a big problem in the world that the birth rate has fallen. So in many countries, their aging population is high, birth rate has fallen, so the burden is becoming higher and higher on the GDP. So UK is a classic case where their GDP ratio for healthcare is so big. India right now is comparatively younger, but India in 2047 will have a huge problem. We will have the highest population of people over the age of 60. We need to worry about how are we going to take care of the seniors who will then have all these problems. So just think about it. We are having this healthcare crisis with a younger population today.
God.
Imagine what is going to happen in 20 years as this population ages.
I cannot imagine.
I met a CEO of a top hospital and I talked to them about our remote care solutions where they could pretty much manage a lot of their patients using technology remotely, that they don't have to keep coming back to the hospital. The hospital CEO got paranoid, almost paranoid, and told me that there is absolutely no way they will be even remotely looking at this. And I was surprised why. So then he explained me that he is not running a hospital. He's running a shopping mall. This hospital actually has a Starbucks in the hospital. It has many shops in the hospital. It has cafeteria. It has, so many services. So for them, one of their key goals is they want more and more people.
Footfalls
To walk in, and then they upsell services. So they actually want, ideally, the patient to keep coming back with more family members.
Do they have a cinema also in the hospital?
Very soon, maybe. But the point is that the hospitals are not wanting to keep patients out because think about it, right? Business now, unless it is absolutely important, we do on virtual calls.
Right.
But hospital, even though the procedure may not require a physical examination, the hospital will still insist that you come, not because it is needed, it's because it is their business model.
It's their business model.
So again,
Makes sense.
there's nothing wrong in the CEO and the team, but the system is rewarding more people to enter the hospital versus keeping more people away from the hospital.
Makes sense.
Which is why another interesting data point for you, the highest teleconsultation in India happens on eSanjeevani, which is the government's telehealth portal.
Wow.
Because the government is not incentivized to keep calling you.
Right.
So more people in the rural and the lower settings are taking teleconsultation on eSanjeevani platform, while teleconsultation on private is absolutely low.
But because they're not incentivized, obviously the rate of solving problems via the phone or video or whatever is much easier, much higher than it would be in a hospital where they'll always say, sir, aap andar aao, aap andar aao, aap andar aao.
Government hospitals want people to go out to reduce overcrowding, while the private hospitals want more people in.
Right. A Niti Aayog study found that over 7% of Indians are pushed into poverty every single year purely because of healthcare costs. That's crores of families falling into poverty from a single hospital bill. Why is this still treated as background noise and not the biggest crisis of our time?
I think that's the fundamental problem of our healthcare system. We live in a country where we have a for-profit healthcare system which dominates. So the poor people go to the government system, which again has huge challenges. But if you really want quality care, you have to go to the private hospitals. And medical inflation has been rising so crazily that a simple procedure today can cost you anything from 20,000 to ₹1,00,000 of rupees. And for a person whose average income is 10,000-12,000 rupees or 15,000 rupees a month, this could mean a year of salary.
You talked about medical inflation. What is the level of medical inflation would you say today?
So
what do you mean by medical inflation?
So medical inflation on last count was almost 17%, between 17 to 18%.
Really?
Which means every year the cost of a procedure or a bed or anything in the hospital increases by 17%.
17%. That means every
17.
4 years it's doubling
It's
basically.
doubling. So, and this is already happening. So if you look at 5 years back, the cost of procedures and the cost of procedures today, there is already almost double. The other thing which is also happening in the healthcare system is that since these are all now being run by professional organizations, they are having a lot more cost loaded to this. Previously, it was nursing homes operated by a family or a doctor and
A private trust. Or
so the previous setups were more, let's say, mom and pop shops. They did not have as much overheads. But today, as large hospital groups are running over and taking over this, their administration cost overall goes even higher. And the third and the most important thing is that the pharmaceutical industry also is increasing the cost of drugs. So I think we are having overall industry increasing cost. And who's paying for it? It's insurance. Where in the case where there is an insurance cover, where there is no insurance cover, it is out of pocket.
why do you think pharmaceutical companies are increasing their prices, as you said?
So right now, the pharmaceutical industry is also going through a big challenge. A lot of the drugs which were in IP are becoming generic, and
Global
they-
drugs.
global drugs, including we are expecting even Ozempic and all these guys going and coming in India in generic form. And while these drugs are coming in, the cost of R&D is going up and up for them. So the only way for them to recover the cost, especially on the, let me use the word, high beta diseases. So there are certain diseases which are where the cost of care is very high. So when it comes to transplants, when it comes to lung cancer, when it comes to any kind of brain surgery. So while on the lower end, the drug prices are fine, but on the minute you have a serious condition, it is inelastic, price inelastic. You have to, if you are on chemotherapy and you need that drug, you need that drug.
And those prices are going up.
And those prices are going up. So even though the government is trying to put price caps, but certain conditions,
Very special, unique, specific, high-end kind of.
and exactly right, you can't negotiate on this because you don't even know what is the right drug.
Right.
So, and the same thing, by the way, happened in the US. So the unfortunate thing is India healthcare model is going the US way, where currently insurance penetration is less. But the problem in the US is that as the healthcare costs started going up, the insurance premium started rising to the extent that today a tooth extraction in the US can cost you $2,000, which in India costs 2,000 rupees. But at the rate things are going, I won't be surprised in the next 5 to 10 years, you will pay 1 lakh rupees for a tooth extraction, even in India.
But then where does that money go? Because when you explain it like that, it sounds like there is an additional massive burden that is coming on me, the patient, the consumer, because of this nefarious system. Or these problems in this system between insurance companies and hospitals fighting each other, blah, blah, blah. So where is that leakage happening?
I mean, it's not leakage. I mean, this is capitalism, right? These companies are operating from profit. They are all listed on stock exchanges now, and more are in the process of getting listed. They have shareholders. Shareholders need returns.
The big companies are squeezing profits and the average person.
See, incentives drive behavior. Today, the incentive for hospitals is to have their beds occupied and the price, or they call the revenue per bed, to be higher and higher. So if your KPI is that is what the entire system is trying to deliver. So everybody in the hospital system is incentivized to meet those KPIs. And that's like any other business, right? If you are running a organization which is selling beverages, your entire system is incentivized on number of bottles sold, number of cities. So that's exactly what is happening in the healthcare system.
And the report said that, the average private hospitalization costs 6 to 7 times more than a public one. Yet almost 70% of Indians don't have any insurance, even though they're going to private hospitals, which is an insane burden, basically. So what do you think can be done about this?
See, I think again, the lack of insurance penetration comes from a number of other things. And one very, very big thing over here is how the insurance system and the healthcare system works together. Today, the insurance, when you are trying to buy an insurance policy, it has so many exclusions and pre-existing conditions and so many things. So you are not even sure that after you buy a policy, will you actually get the coverage? So there is one big challenge around that. And the second thing is, if you go to the hospital, the minute they see you having an insurance policy, the pricing of all the services are different. In fact, there's another very interesting stat which I heard, that people who have insurance, almost 72% births are cesarean versus less than 20% of cesareans in a non-insured category.
So you're saying they're incentivized to make you spend more money.
I mean, clearly, right, these are for-profit companies, and now a lot of them are owned by private equity, and they have only one focus, which is driving top line and bottom line, and this may or may not be at the cost of delivering good services.
As per your IndiaFIT report, I read a statistic that really stood out, which was that 1 out of 2 families pay hospital bills by taking their savings, and about 13%, which is more than 1 out of 10 families, borrow money. How does this emergency surgery fund, how should someone think?
Average procedure today will cost you between 3 to 10 lakhs. And today, if you have parents who are above the age of 45, 50, 60, a heart attack can cost you that much.
Right.
And now, even if you go to the cheapest hospital, depending on the surgery, let's say putting a stent or a bypass is at least going to cost you 3 to 5 lakhs. Now, nobody has 3 to 5 lakhs available immediately to pay. And when you are not having an insurance cover, you are supposed to deposit this money in advance. It's not like after the surgery you can pay. So suddenly, because most of these things happen in emergency, you are ending up with the needing this particular money, which is why you end up either borrowing the money or breaking your fixed deposits or whatever else. And that's why that one health incident can suddenly get you massively down from a financial perspective. We as humans, if you ask a simple question, do you want to go to heaven? Everybody will say yes. Everybody wants to go to heaven. But do you want to die? Absolutely no. So I think that's the fundamental problem. People always believe that something bad like a health is not going to happen to me. So we are all in denial, even you and I, because...
how else do we survive in a way?
Exactly. So the point is that insurance is something which you think the last in case of something going wrong.
We brought up insurance many times, so just want to talk about that a little bit. As per the IRDA, which is the Insurance Regulatory and Development Authority, a government body, last year insurers rejected 26,000 crores worth of claims. 1 in 5 claims was rejected, and for every 100 rupees claim, only 70 rupees was approved. Why does insurance fail the exact moment it's supposed to help?
So, a few years back, we did a survey of 10,000 people asking them, who do you trust in healthcare and who do you not trust? 98% people said they don't trust doctors, hospitals, insurance companies, pharma companies. 98% people don't trust.
So that's the whole of healthcare. That's the whole system.
And then we asked them, who do you trust? The number 1 name was Baba Ramdev. Number 2 name was Akshay Kumar, which is why, we were able to then get Akshay Kumar onboarded.
Wow.
So the challenge of the system is that the system designed to take care of your health and well-being, all the stakeholders are not trusted by any customer. Secondly, they also don't trust each other. The hospital always thinks that their claims will get denied, so they pad up the claims. The insurance company always thinks that the claims are padded up, so they reduce the claims, what they pay off. The consumer is worried that his claims are going to get denied, and he's running from pillar to post to get their claims approved, and then they're happy ki chalo kuch to approve ho gaya. So currently what your expectation was that 100% of my claim needs to be approved, and it is because in the past they have been burnt by some fraud.
Yes.
So the whole history of this is that when the system was, let's say, very, very lenient, there was a lot of misuse. In fact, I have to tell you this story. My wife was getting a procedure in a hospital, and we were covered by one of the best insurance plans. But when we applied for the cashless, the insurance person insisted that they want to come and meet my wife face to face. And I was like, why does an insurance person want to meet? He's not a doctor. So I happened to know the CEO of the insurance company and asked him that why is your guy wanting to meet my wife? What is the issue? So he said that now, as part of their policy, they have to confirm whether it is the right person getting the treatment.
Right.
Because in the past, Ram was getting treated while the insurance documents were given of Sham. So there is so much malpractice in the system that the insurance company, whenever it gets a claim,
Has to be.
is looking at it from suspicion of trying to see, is there fraud over here? Similarly, at the hospital end, they are thinking that this person anyway has an insurance cover, so why can't I add additional charges? It is anyway going to come from the insurance company. And the consumer is the one stuck in the middle because they have a loved one in a hospital system
The honest consumer.
whose discharge is delayed. So a lot of times, and I have experienced it myself, that after the surgery is over, the discharge can take 7, 10, 12, 24 hours. Because during the discharge, what is actually happening is the negotiations between the hospitals and the insurance companies. And the process is extremely painful. The reason you are seeing such high denying of claim is because the insurance companies are also making losses. If you see the publicly listed companies, except a few of them, most of the insurance companies are running at losses, which means their claims are higher than the premiums they collect. And that is higher because either they are not doing the right pricing, or the only way for them to then somehow manage their claims is by denying claims. So it's the perfect storm that the healthcare companies, the insurance companies, and the pharmaceutical companies all together are trying to make money from the consumer who has currently no say in this.
Recently in the news, we've heard a lot about this big fight between all the hospitals and all the insurance companies to a degree where they banned all cashless transactions also.
So let me tell you the problem. And luckily I was close to this because one of the persons representing the insurance industry, Dr. Tapan Singhal, he's the chairman of the General Insurance Council, is somebody I know very well, and he's the CEO of Bajaj Allianz. So he was the one leading this discussion with the healthcare companies. So the insurance companies had a very simple ask saying that can we have a rate card or some pricing so that we can approve a cashless plan. So the problem was that today, if you enter a hospital with your insurance card and ask for cashless, you are literally an ATM machine for the hospital. Now, they want to remove as much money as possible. Let's put it that way.
Yeah.
And
the insurance company is worried about that.
And the
because they'll have to
insurance
pay.
company is saying that, listen, let us know what the problem is, what is the procedure, and what is the rate card so that we know we will approve. Let's say you have a 5 lakh policy, I
Right.
can approve 1 or 2 or 3 lakhs.
Right.
So the debate really over here was the hospitals are not willing to give this. I'm generalizing. Of course, there are more nuances to this. The hospitals are saying we don't know. The situation can become complicated. It can be 1 lakh, but what happens if the patient becomes sick tomorrow? So the whole fight is that insurance companies want transparency and accountability on pricing, and hospitals are saying that is not possible, which is why the discharge experience is very pathetic. So basically, this fight reached a point where hospitals said, we are not going to accept cashless at all. And now I think, again, I think there was some intervention and they've come back. But this is not a problem which is going to go away. because of the fundamental lack of trust in a system, which is why there is an urgent need for the government and the regulators to come in and fix this system. And this can be fixed by firstly aligning the interests of all the operators here. Currently, the incentives itself are misaligned. And if the incentives are misaligned, there is just no way the consumer can win. For the consumer to win, the insurance companies, the healthcare providers, the pharmaceutical companies, the hospitals, the healthcare professionals, they all need to be aligned, which is the fundamental problem.
I don't know how that'll ever happen though.
It is possible by going to what we call value-based care, where you incentivized outcomes rather than incentivizing service. I mean, this has happened in many industries. When you are today investing in a fund, they are saying, I'm going to take a percentage of the profits I make. So you're incentivized, that your wealth manager is working with you to grow the money. So there are many models, and there are many countries where such models are getting implemented.
In healthcare?
In healthcare too.
Do you think insurance companies will ever reward prevention and healthier lifestyles instead of just charging premiums?
See, that's exactly the point. So insurance companies, at least one good thing is that the people who want to make you healthy are who? Your insurance company, government, your parents, your government, your family members, your insurance companies. They all want you to be living healthy and longer. ताकि आप premium भरते रहो और so because their incentive is aligned with you. So insurance companies, again, not saying that they are holier than thou. They of course have their own challenges.
But the incentives are aligned.
But their incentive is that you continue to pay premium and you claim the lowest.
Yes.
Which is why worldwide insurance companies are now saying that how do we prevent? And let me give you an example of the problem of not just India, globally. Imagine there is a highway where cars are constantly getting into crashes. The solution the people come up with is let us open more garages and have more mechanics in the highway. So what they do, don't do anything. Now suddenly that same highway has 100 garages and 1,000 mechanics, and all of them are competing for business, which by the way is now leading to more potholes on the road and more incentivization to get more accidents so that business goes to all these 1,000 mechanics. Same is the problem with healthcare, that we have a system where people are suffering from lifestyle and chronic diseases, which are leading to heart attack, cancer, etc. Now, instead of focusing on people living healthier lives, or in the case of driving, if we want to focus on wearing a seat belt, don't drink and drive in lane, that is what is going to prevent accidents. Similarly, if your population is suffering from non-communicable diseases, you incentivize the behavior which will lead to healthier lifestyle so that you don't have to go to the hospital. So preventive care is now becoming the core mission for all the major governments, insurance companies, and healthcare systems. And we work closely, for example, in the Middle East, where all the big kingdoms there are, Saudi has something called Vision 2030, where quality of life is one of the most important things. Or the UK, while NHS has lots of problems, but NHS's core goal is to reduce healthcare burden and improve outcomes.
Right.
So in countries where they have the model now, everything is shifting to preventive care.
And in India, what is happening with the Indian model?
So India is still right because state healthcare is a state subject. So there are some central schemes. And while we had Ayushman Bharat, we know that there were a lot of fraudulent claims around Ayushman Bharat also, and I'm sure the government is fixing it. So the government is trying to do new things. They created something called the health ID, like the UPI or the Aadhaar equivalent. There is a health ID system. They even created a national exchange for insurance claims, where they thought that all the claims can centrally go in and then claims can be settled. But the problem is nobody is using these systems because the providers want everything to be fragmented and siloed. The government wants everything to be in one system and transparent. So the systems are created in India, but the private healthcare system is not really incentivized to use the system. And the same thing happened in UPI. If you remember, when UPI was created, none of the banks actually did anything about it. It were companies like Paytm, PhonePe, all of them who were not banks, came from outside, used UPI
To make it for everyone.
The banks themselves are just pipes. So I do believe that as India builds the health infrastructure in form of the health ID and all the transparency we want to bring in, it will require players from outside the industry to come and disrupt it. The current players just won't be able to do this because they have too much already at stake on their traditional business models.
So if you want to bulletproof yourself financially against all these horrible things that have happened, what are the smartest moves you can make right now?
You have to buy insurance the earlier the better, because the insurance regulator has done a very good thing. That once you enter an insurance policy, they cannot throw you out.
They cannot throw you out.
As long as you continue paying the premium.
Huh.
But at the time of entry, they can deny you or say your conditions are not valid. So when you are relatively young, you don't have health conditions. That time when you get the policy, you have the best coverage as you age.
What age do you think is a good age to get into the system?
I would say the minute you cross 29,
Right.
the minute you enter 30s, I think you should get an insurance.
Right.
The best thing is you can get a family floater. So you don't need to just buy it for yourself. So let's say if you have a 10 lakh family floater plan and there are 4 members covered, that's even better. So you can make sure, and especially if you have parents who are older. So see wherever possible for you to include your parents into the cover or buy a cover at least.
And so if you're 25 and or 30, if you're 30 years old and you're buying your first policy, what are the most important questions you should ask before you sign?
See, normally, our first reaction is let us buy a policy with the lowest premium. Actually, that is the wrong way of looking at insurance. In insurance, you have to say the policy with the highest payout rates and which has all the less exclusions. So a lot of times, again, right, because there are online systems, they will show you a premium which will seem to be the lowest premium.
Sasta wala lenge.
But suddenly that Sasta wala plan may, there will be 1,000 exclusions. There could be exclusions which you don't even realize.
Right.
Pre-existing condition date. Some of them say 1 year, some of them say 2 years, some of them can say 3 years. So which means if you buy this policy which was cheaper and 1 year later, let's say you have a kidney or a liver condition, they will say, sorry sir, this policy had 2-year exclusion or 3-year exclusion. So suddenly your policy is of no use. So I would say don't be obsessed about the price. Be obsessed about what is covered, what is not covered, and what is the record of paying claims. So today the regulator also shows you which company has the record of paying the most amount of claims.
Some are quite high and some are quite low.
So, let's say you're buying a cheaper policy and you see this company's record is paying the lowest claims. That's the biggest red flag.
Can you give us 4 hacks to make sure your insurance doesn't betray you when you really need it in the hospital?
So I think, first of all is pre-existing condition. Secondly, if you take tests, insurance companies like that you are being proactive. So they have record that you are doing tests also. So the way to think about it is that if you are somebody who is constantly showing positive behavior, your likelihood of your building trust with the insurance company is also very high. And the other thing which I also do is then I try to consolidate my policies with one insurer. So for example, my bike insurance, my car insurance, everything is with one. Ideally, if you can consolidate, so what happens is the insurer will see, this is a credible customer. And if you go to a reputable hospital, by the way, there are many hospitals which are known for malpractices. If you go from a hospital who's already known for malpractices, the chances of denying of claim is very high.
Got it.
And one good way to see is who's the TPA.
What is TPA?
A third party administrator. So the TPA is the one who's the interface between the hospital and the insurance company. These TPAs are sitting inside the hospitals. If you go to a hospital facility with a TPA already there who accepts the cashless claim, then it is even better. So the way to think about it is that what are the good signs that your insurance company has high claims paying rate, has a TPA in the hospital in advance, who possibly gives you tests and services. So the way to think about it is, I can, as an insurance company, how do I make money? I make money by collecting premium every year, and then I pay for people who are sick. A good insurance company, if they have done a good job, normally the premium collected versus what they pay should give them the profit.
Right.
But what most companies are today doing is, only way to get profit is by denying the claim.
You've mentioned ultimately that prevention is the way forward. And one of the areas which you work in with GOQii is prevention through tech, through wearables and through an app. From whatever I've seen, 1 in 3 urban Indians own some kind of a wearable, a smartwatch or a fitness band or a ring. But after some time, after 2-3 months, it ends up in the drawer. So why do you think this happens? Why do gadgets fail to change behavior or impact your health positively?
Yeah. See, I think behavior change is a very complex topic. And the amount of, first of all, the way to think about it, it took you so many years to develop a habit. But you are expecting to change that habit almost immediately. And what happens is, whenever you get something new, you have the initial effect of excitement. So for the first few weeks or months, you are all into it.
You're looking at it and saying, wow.
But eventually, the motivation starts wearing out, and eventually this goes into the drawer. And this is not just with wearable devices. It is with anything to do with health and fitness, whether it is the gym which you always join on the 1st of January and after 2 months, or it is the diet which you do for 2 weeks and then you go back to your old diet. And this goes back to how we are wired as humans. We are wired to seek pleasure and happiness. And there's a very interesting framework for what is happiness and what makes you happy. And the framework is simply defined that x-axis of what I call experience level and y-axis of difficulty of task. So let's say on day 0, you are not experienced at all. You come to me and I say, from tomorrow, Mukul, you have to run 5 kilometers every day. Now you are not experienced at all, but I give you a very difficult task. You'll do it for 1 day, you'll do it for 2 days, you'll do it for 3 days. On the 4th day, you will say, forget it, because you got frustrated because you kept failing at that task. Now let's take another example. You are an Olympic athlete. You do everything, and I'm telling you, every day walk 1 kilometer. Now your experience level is very high and I give you a very easy task. So you get bored. What is happy? When you feel happy or when you feel motivated is when you are in that zone where your experience level and your difficulty level is matched, so that you have to kind of keep increasing your level a bit to be in what is called the state of flow. That was the core insight of GOQii, that devices, apps, and data on its own becomes noise over a period of time. But if you are able to synthesize the noise and make it into a gamified, engaged way, you can get people hooked and addicted to this. Just the way you are hooked to seeing your Instagram reels, because they are using the same techniques for getting you back. The same techniques can be used for good purpose, which is make you drink more water, make you sleep better, and make you eat healthy and
take more steps.
So first of all, like I said, right, these devices are just one data point. They are not the solution to the larger problem. And I think you need to be very clear on what is your goal. So one of the reasons Whoop has been so successful is because Whoop constantly tells you that whether you are ready for the day-to-day, what is your strain level, and if your strain level is very high, you should not be doing more workouts on a particular day.
I see.
So the way they have been able to show you something actionable
It's daily readiness.
is whether you are ready for the day. So the reason Whoop has become so successful is because they were able to just take data but translate into something which is very actionable for you
on
a daily basis.
On a daily basis.
Now the good thing is that with a good AI model combined with a wearable, combined with your blood report, models are going to become predictive. So now models could say that, hey, based on your current pattern, your data, I predict that you may get a heart attack in the next 3 months, next 6 months, or you may get a stroke in the next 12 months, or you may have this problem. So the best part is right now, all these devices and data were all individually kept in silos, but AI models are now combining them. And by combining them, all the health is going to become predictable. So you will now see, and Apple has just launched their new device with blood pressure. They can, our device can predict so many things. You can predict fault detection.
But can you feed your blood report into these devices?
Not into the devices, into the app.
Into the app,
you
you
get
can.
the data from the wearables, but then you get your blood report and you can get some few more parameters. So once you get 3-4 different parameters, you can very easily start creating predictive models. So healthcare currently was reactive. You go after you get a symptom, you may or may not go to the doctor, but you ultimately get a heart attack is when you go to the doctor or hospital. And then the treatment starts.
Right.
Now, if you are able to keep a good AI device with you, you will already know that you have a high risk for something. And now you can take preventive measures so that that doesn't happen. So it is going to become predictable, personalized. Now that we have predicted, then it is all about what is your journey, what do you need to do. So healthcare is going to now become personalized for each person based on their own data.
But it's not yet become it, I think. No,
It is already getting there.
I have a lot of information on this when I sleep. I have information on this when I exercise. I have a lot of blood tests and MRIs and all. And I have to feed them all in a chat GPT. In fact, this stuff I can't even feed in a chat GPT. So right now it's all...
So now there are new AI models, like the model we are developing can take all this data and put it into one thing. We call it the Alive OS.
Got it.
So we are creating, and there are many more companies creating models which can aggregate this data and create insights. And then goal is to prevent. So you predict, personalize, and prevent the lifespan. Outside India, Japan is 85, 90, 100. So already people are able to live in India, live about 70 years. Of course, the quality of life might be very poor, but you can still live 70. So the question is, with preventive care, AI, wearable devices, and all the advancement in science, I have a firm belief that the person living 70, there is no reason why they can't live for 100. All they have to do is adopt a preventive lifestyle versus waiting for them to get hospitalized and then get into that spiral of what is happening today.
Now, suppose I have enough money just to buy one wearable. In the long run, like you said, sooner than later, you're going to have all this, everything's going to come together. But right now, I don't have time to think about all that. I'm just there. I want to be a bit healthy. What should I buy? A ring, a strap, a watch? What do you recommend?
So one of the best indicators of your health is, and let's do this together. Let's put your heart rate right now.
Current heart rate.
Yeah, current heart rate. Let's see what your heart rate and my heart rate is. So this is what is called a resting heart rate.
Yes. Semi-resting. No?
I mean, we are right now seated and maybe we're a little excited, but we are not running or doing any major.
75.
So you're 75. Let me see what my comes up. So.
And 6 minutes ago, it was 65, 70, minus 70.
So mine is
84.
Now 84. Let's give it another second. 83, 82, 81, 80. So yeah, 70 to 80. And normally when you are asleep, your heart rate should go even lower. So in my case, when I am asleep, my heart rate can go as low as 50. So a low resting heart rate is an indicator of good heart health. I have seen people whose resting heart rate is over 100, over 90.
Really?
Yeah,
Over 100?
over 100.
Resting heart rate?
Resting heart rate. And they're doing nothing about it. So if you can just do one thing, is test your resting heart rate.
With
If
your
you-
new
with
fancy
any device.
With your fancy new
with
device.
any device, you can even use that.
Yeah.
See, steps to today phone can also track.
Phone kuch nahi
Right?
hai.
So all I'm saying is if you only have budget to buy one thing, I would buy or get a device to measure my heart rate, resting heart rate. And resting heart rate is a very good indicator of your health. High resting heart rate, and I want to clarify, you don't do this after running, you don't measure this, or after climbing stairs. You are just seated doing nothing. If this is higher than 90, it is a sign that something is wrong.
You're talking about the operating system. Do you think that constant tracking, like now I have got this a month ago. Now I look at my sleep every morning. The first thing I do when I get up, I look at my sleep score. Is it above 80 or not? And very often it's not above 80. 75, 70, 65 once or twice. Does that cause its own set of problems with people? Like do people get worried about continuously being over focused on, one or two parameters?
See, data always empowers you. Data can never give you stress. It empowers you. And that is the fundamental problem. When we look at any other business, we need real-time data. You need stock market price right now. You need sales data right now. You need your exam results right now. But when it comes to health, you're saying, oh, will I get stressed looking at the data? The reality is our bodies generate trillions of data points. Every second, there are so many processes running in our body. Our breath, our heartbeat, our blood pressure, our brain neurons, so many.
Oxygen
There are
level.
so many things happening in our body. And the answer to our problems lie in this data. We are currently ignoring them, being indifferent, which is leading to this whole problem of health crisis. I believe eventually between wearables and even implants, I think the next set of devices will not be wearables. They will be implanted in your body. And we know already Elon Musk is doing the Neuralink. So you will be able to completely predict what is going to happen to your body.
I just saw an ad for a ring, and which showed that there was Ranbir Kapoor running on a treadmill with 10 doctors monitoring him, and slowly all the doctors disappeared, and basically all the ring was like many doctors. Do you think health tech has been a bit overhyped today, promising more than it can deliver? Today, I'm talking about today. I'm not talking about the future.
See, that's exactly the point, right? People think that by just wearing a wearable, they have become healthy. That's like thinking that by just putting a photograph of God in your room, suddenly you have become blessed, right? I think.
But don't you become blessed by putting a photo?
That's exactly. It is giving you that impression. So wearables in itself are junk. Completely junk.
Yes.
Any wearable.
They're just a tool.
They are just a tool to measure. You cannot use the tool to measure to decide outcome. Outcome is a result of effort. So you have to combine the data with effort and personalization. So our focus, by the way, is no longer on wearables. It's more around what do you do with the data and how do you transform your health and life and live longer. So that's really where the science is going. So I would say people that don't waste your money on buying expensive wearables. The point is, it is about proactively looking at data. You have to be the CEO of your own life and your own health. You cannot depend on the insurance company, the hospital, the doctor. We all know during our conversation that these are people who are the least trusted. Of course, you have to go to them when you need them, but the only person you can trust is you and your loved ones when it comes to your health. You can't depend on anybody else.